20, 30, 40 years ago, there was only MBBS doctors, the very few MDS doctors. Why are there more MDS doctors today? Why is there more specialization in dentistry? Today, if you have a problem, you'll go to an ENT specifically, or a dermatologist specifically, an ophthalmologist specifically. Why? Because the amount of information available in each aspect of medicine is so much that it's impossible for one doctor to know more than one or two things. The same thing is happening in dentistry, because dentistry is a hard subject. So everything takes time, because experience is counted till the time you were learning. The day you stop learning, that day your experience stops. First you had silver amalgam. Now silver amalgam does not bond to the tooth, so you have to create retention. Now comes composite. Composite today, every single dentist knows, can be extremely predictably bonded to the tooth structure without having any retention. इस composite के ऊपर अगर आप ceramic चिपका दोगे, तो आपकी इनडायरेक्ट एडिसिव डेंटिस्ट्री हो गई.
लैब एंड डेंटिस्ट कम्युनिकेशन.
यस,
मैं ये मानता हूँ कि अगर टेक्नीशियन को गैस वर्क करना पड़ रहा है, मतलब कि आप इस कम्युनिकेशन पार्ट में कहीं पे फेल हो गए.
बिल्कुल. मैं दो चीजें बताऊंगा इसमें. पहली चीज, आई वांट टू टेल यू दैट डिजिटल डेंटिस्ट्री बेसिकली विद द स्कैनर, इंट्राओरल स्कैनर, can help bridge this gap. The second thing that can bridge this gap is,
पहले के ज़माने में जब वो स्कैनर्स नहीं थे, तो इम्प्रेशन लैब को भेजना होता था. फिर वहाँ से कुछ प्रॉब्लम आया तो अभी यहाँ पे फिर कुरियर करने में फिर 2 दिन जाएंगे.
You don't always need to work with your local labs, especially when you know people in tier 2, tier 3 cities are very comfortable giving work to within their city.
ट्रेनिंग हाथों की है, ब्रेन की है, उसके साथ ये माइंडसेट को भी थोड़ा स्विच करना ज़रूरी है कि ये अगर लैब और डेंटिस्ट का कम्युनिकेशन में जो ये फ्रिक्शन हो रहा है, उसको अगर इफ़ यू वांट टू रिड्यूस इट, just do one exercise.
Value versus affordability. So you must be able to create that value. How do you create that value?
Price is the problem. But what I felt is price is not always a problem.
Yes.
You need to address fears, you need to address doubts, you need to address patients' insecurities, from where they are coming from where their thoughts, I would say excuses, the reasons. You need to respect all of them. I have felt this since many years, but still, I again felt this today, that dentistry is such a vast field.
Yes.
Dentistry is hard, dentistry is precise, and dentistry is tedious.
But dentistry is extremely fulfilling. Why do I say it's fulfilling?
Dr. Karthik Dinoja, periodontist, implantologist, founder of Karthiktva, and the voice behind India's most famous dentist. Winner of the Golden Mic Award for Best Dental Podcast, honoured as Dental Influencer of the Year by the Dental Excellence Awards, and recipient of the Smileverse Award by the Indian Dental Association. Dr. Karthik brings you conversations that go beyond clinical success and into the real journeys behind it. This is where dentistry's biggest names reveal what success really looks like. The mistakes, the challenges, the lessons, and the moments that changed everything. The conversations behind the careers. The stories behind the success. Welcome to India's most famous dentist. A podcast by Karthiktva.
You're absolutely right.
Thank you very much.
Whatever you are doing at the moment is also serving the nation.
Thank you, Dr. Karthik.
Listening to podcasts such as yours, you are not doing dentistry, you are doing self-development.
So, what are you waiting for? Grab your popcorn, sit back, relax, and enjoy the show.
What I'm saying is, try to master one or two aspects of dentistry while initially doing other things also. मतलब आपका एक ज़्यादा इंटरेस्ट और एक ज़्यादा पैशन. Let's for example, अब एग्जाम्पल से बात करते हैं. Let's say somebody is really interested in anterior composites, anterior or even posterior composites. Let's say composites, they are very interested in composites. So they can start working in an additional way to keep improving, keep documenting their composite restorations and all the beautiful anterior aesthetic cases while doing RCTs, while doing all the other things. Right. I do all the scalings in my practice even today. Every single patient that comes to our practice, 99% I'm doing the scalings. Right? So I'm doing everything. ऐसा नहीं है. But I don't do root canals. Right? But I do implants. I do everything else. But the point is that there are some things that you love more than others. Foster that love. While doing other things, foster that love. And hopefully in the future, you will reach a point where you'll be able to focus more on the things that you love and less on the focus that you don't love. This is just an attempt. It's a direction that you want to go to. It is not an absolute. I don't want your listeners or viewers to think that I'm saying कि ये दोनों करो बाकी सब छोड़ दो, become a specialist. No.
Right.
You be a general dentist, but try to foster love for one or two aspects of dentistry and try to move in that direction. And many times, for many of you, it could be possible that the future is a situation where you're doing much more of what you love and lesser of what you don't love. And that's what I wish for you. And that's what I mean.
Right.
Right? So spend a little time understanding where that interest lies.
That interest can come from anywhere, like naturally भी आ सकता है,
Yes.
from your mentor, from the social media.
Yes. Don't follow trends, but try to introspect and think, which aspect of dentistry do I love?
Right.
Do I love implants? Do I love implant prosthos? Do I love perio? Some people love perio. Some people love doing root coverages. Some people love posting that kind of stuff. I don't.
Right.
Some people love composites. You see all this beautiful composite work that's happening. That kind of composite work doesn't even pay that much, but still people are doing such amazing work that has to be coming out of passion, right? So that's the beauty of dentistry. It gives them so much happiness to do that quality of work. So find that passion, and that passion does not have to be in the broad field of dentistry. It could be one aspect of it. And the other thing, let me tell you about specialization. See, 20, 30, 40 years ago, there was only MBBS doctors, the very few MDS doctors. Why are there more MDS doctors today? Why is there more specialization in dentistry? Today, if you have a problem, you'll go to an ENT specifically, or a dermatologist specifically, an ophthalmologist specifically. Why? Because the amount of information
Yes.
available in each aspect of medicine is so much that it's impossible for one doctor to know more than one or two things. The same thing is happening in dentistry. There is more and more and more and more and more information, and higher and higher and higher and higher quality of treatment for each aspect of dentistry. Therefore, one person can't do more than one or two things. It's the same thing. जितनी knowledge बढ़ेगी, उतना आपको specialize करना पड़ेगा.
इवन मुझे ये वर्कफ्लो पे भी चाहिए कि आप उसको इलेबोरेट करो कि व्हेन यू आर डूइंग अ सर्टेन प्रोसीजर, जो सिर्फ एक ही प्रोसीजर आप सीख रहे हो, या तो कंपोजिट विनियर्स कर रहे हैं, पोर्सलिन विनियर्स कर रहे हो, उसमें भी बहुत सारी चीजें हैं. इफ यू आर जंपिंग इनटू डिजिटल डेंटिस्ट्री, तो उसका वर्कफ्लो बहुत ही लेंदी है और उसमें भी आपको प्रिसाइज रहना पड़ेगा. सो आई वांट यू टू टेल आवर व्यूअर्स कि वो कितना टीडियस प्रोसेस रहता है और क्यों आपको 1 से 1.5 से 2 साल सिर्फ उसको सीखने में और एक्सेल करने में देने चाहिए.
Well, because dentistry is a hard subject, so everything takes time.
Yeah.
And it takes experience, it takes time, and it takes conscious effort to continuously being better. Just we were talking earlier about experience. I don't think when you say a dentist has 30 years, 40 years experience, it means that he is better than somebody who has 20 years experience, because experience is counted till the time you were learning. The day you stop learning, that day your experience stops. So you could be having 40 years experience, but if you stopped learning 25 years ago, you only have 15 years of experience, because then you've just been doing the same thing again and again for the last 20, 25 years. So it takes some time to understand what you like and try to pursue that. Yeah, that's what I would like to say. And finding mentors and courses, I think, is one of the best ways. And of course, अगर mentor और courses भी नहीं करना, उसमें भी पैसे नहीं खर्च करने, तो आप social media पे देखो कितना सारा free information available है.
Yes.
There's so much of free content. We all are providing, including people like me and many others. हम भी कितने सीखते हैं यार. So many people within India and abroad are sharing such beautiful cases. And then what do? You look at those cases, you're like, यार मेरा case ऐसा क्यों नहीं लगता? And then you start pursuing that, and suddenly you realize 1-1.5 साल के बाद यार मेरा केस और उसका केस तो सेम ही लग रहा है.
सेम है. यस.
सो ये मतलब किसी को देखो, इंस्पायर हो, उसकी तरफ चलो. अगर उसकी तरफ चलते चलते बोर हो गए तो किसी और की तरफ चल लो. तो ऐसे आपको फिर डिटरमाइन करना है आपका इंटरेस्ट. एंड होपफुली बाय द टाइम यू आर 35-40 years old, you're really locked into what you want to do, and then you put all your efforts into that direction.
तो अपने आप वो एक डिसीजन ट्री बनता जाएगा.
डिसीजन ट्री करो उसको.
Yes.
Don't get locked in by your mindset and MDS.
सोशल मीडिया पे अगर आप देखते हैं सी ट्रांसपेरेंट बातें जब होती है, इवन आई वाज वाचिंग अ पॉडकास्ट जिसमें यही बात हो रही थी। पहले के ज़माने में जब वो स्कैनर्स नहीं थे तो इम्प्रेशन लैब को भेजना होता था, फिर वहाँ से कुछ प्रॉब्लम आया तो अभी यहाँ पे फिर कुरियर करने में फिर 2 दिन जाएंगे। कहीं ना कहीं पे बिगिनर्स ये सारी चीज़ों को रिलेट करते हैं। अगर किसी को ये मालूम ही नहीं है कि ये 2 दिन फिर से जाएगा, फिर से वहाँ से वर्क वापस आया, तो उसको इतना बुरा फील होगा कि ये मेरा वर्क फेल कैसे हो गया। लेकिन जब आप ऐसे लाइक माइंडेड लोगों के साथ या फिर ऐसी स्टोरीज आप सुनेंगे, फेलियर स्टोरीज भी सुनेंगे, तब आपको मालूम पड़ेगा कि नहीं, ये तो नॉर्मल है, इसमें इम्प्रूव करना होता है, इसको छोड़ नहीं देना होता।
बिल्कुल।
और जैसे सर ने बताया कि बहुत सारी टेक्निक्स यूट्यूब पे अवेलेबल है, सर के कोर्सेज भी अवेलेबल है और बहुत सारे अच्छे अच्छे स्पीकर्स के कोर्सेज भी अवेलेबल है। और ये कोर्सेज करने के लिए अगर आपको कुछ मोटिवेशन चाहिए तो हमारे यूट्यूब चैनल के हमारे जो एपिसोड्स है वो देखिए।
Yes.
आपको सक्सेस और फेलियर स्टोरीज दोनों देखने को मिलेगी। तो सर इन बिटवीन ये सारी बातें हुई कि अभी जो ज़माना है वो कॉन्जर्वेटिव अप्रोच के साइड बहुत जा रहा है। आफ्टर रूट कैनाल ट्रीटमेंट अब तक जो डेंटिस्ट्री चल रहा था वो फुल क्राउन के ऊपर चल रहा था, एंड नाउ उससे भी एक लेवल ऊपर कि अब क्राउन्स की भी ज़रूरत नहीं है कुछ कंडीशंस में। तो वो क्या बात
See, basically, there is one huge fundamental shift that is that people, dentists, need to understand and accept. Now, what is this concept? First, you had silver amalgam. Now, silver amalgam does not bond to the tooth, so you have to create retention. For retention, you have to do certain things, which usually means cutting more tooth structure. Now comes composite. Composite today, every single dentist knows, can be extremely predictably bonded to the tooth structure without having any retention. Correct?
Right.
That means that we know that composite can adhesively bond to the tooth and we can trust that bond with our life. Clear? ये आप सबको मालूम
अभी माइंडसेट, हाँ
अभी माइंडसेट ही। अब मैं क्या बोल रहा हूँ, मैं सिर्फ ये बोल रहा हूँ कि इस कॉम्पोजिट के ऊपर अगर आप सिरेमिक चिपका दोगे,
हाँ,
तो आपकी इनडायरेक्ट एडिसिव डेंटिस्ट्री हो गई। बिकॉज व्हाट, हाउ डू यू बॉन्ड ceramic to the tooth structure? With a composite material. Resin cement is nothing but composite. You can even use normal restorative composite to bond ceramic, right? So, and the bond between ceramic and composite is at least as strong as the bond between composite and tooth structure. So if you trust the bond between tooth structure and composite, there's no reason for you not to trust the bond between composite and ceramic. Now, if this is clear, then it opens the entire world of conservative and adhesive dentistry to you.
Okay.
Because अगर आपने एक RCT posterior tooth की करी, तो इसकी हमारी requirement है कि हमको cuspal coverage देना है to protect the tooth from fracture. Now, how do you give cuspal coverage traditionally? You give a crown. Why are you giving a crown? Why is the crown going all the way below, around the axial walls of the teeth? Simply because of retention. Because you need to provide retention for the crown so that it doesn't come off. अब अगर हमने retention को पूरा outsource कर दिया composite bonding के मतलब adhesive protocols पे, then you don't need to give a crown.
Okay.
Then you can simply give an onlay. And what does an onlay do? An onlay sits on top of the tooth, on top of the equator of the tooth, on top of the height of contour of the tooth.
Okay.
So as long as you don't cut the tooth from the side,
हाँ, तो वो reduction की जरूरत ही नहीं होगी.
yes. So you what do you have to remember? Cutting the tooth from the top does not weaken the tooth. Cutting the tooth from the side weakens the tooth.
Okay.
For an onlay, you don't have to cut the sides.
And there will be 2 cuttings because of the caries. हम अंदर से भी कट करेंगे.
Correct.
Crown preparation में बाहर से भी.
Correct. So an endodontically treated tooth is hollow from inside, and then you've cut around the axial walls of the tooth. So outside also you have cut, and inside also you have cut. So you have very little pericervical tooth structure, dentine or just general tooth structure that then tends to break. So and what do we do in India? We give a 15-year warranty for the crown.
Exactly.
Right? But that's a fool's errand, because the crown is an inanimate object. It is a piece of rock. It's zirconia. Nothing's going to happen to it. If you give 2 mm, 1.5 mm care and occlusally, that nothing's going to happen to it. What is the weakest link for the failure of that treatment? It is the strength of the crown underneath. So you give a 15-year warranty, patient comes back after 3 years and says, डॉक्टर साहब आपने तो 15 साल की वारंटी दी थी.
दांत की नहीं थी.
हाँ, डॉक्टर साहब आपने 15 साल की वारंटी दी थी, ये देखो, तो डॉक्टर साहब देख के बोलेगा देखो मेरा क्राउन तो बिल्कुल फर्स्ट क्लास है,
हाँ,
तो आपका तो दांत टूटा है.
दांत गया है.
So that is either making a fool of the patient or making a fool of yourself or both, right? So there's no warranties in dentistry, or there's no warranties and guarantees in medical procedure. There is not a single other medical procedure or dental procedure that you can think of that comes with a warranty. So why only the crown? It's a silly system. There are no warranties and guarantees at Kalra Dental Clinic because it's a medical profession.
Yes. तो सर इससे ही हम बात करेंगे. व्हेन यू मेंशन्ड दैट ये क्राउन वगैरह की बात आती है तो मुझे ये दिमाग में आता है कि जब हम प्रोस्थेसिस देते हैं पेशेंट्स को, मोस्ट इम्पोर्टेंट पार्ट इज लैब एंड डेंटिस्ट कम्युनिकेशन.
Yes.
कहीं ना कहीं पे आई थिंक क्लिनिशियंस आर लेकिंग दिस लैब एंड डेंटिस्ट कम्युनिकेशन. ये नहीं हो रहा है, इसकी वजह से वो टेक्नीशियन को, मैं ये मानता हूं कि अगर टेक्नीशियन को गैस वर्क करना पड़ रहा है मतलब कि आप इस कम्युनिकेशन पार्ट में कहीं पे फेल हो गए हैं.
बिल्कुल.
तो अच्छे से लैब के साथ कम्युनिकेट कैसे करना चाहिए आज के जो फ्रेश अभी क्लिनिशियंस जो बिगिनर्स हैं उनको?
मैं दो चीजें बताऊंगा इसमें. पहली चीज, आई वांट टू टेल यू दैट डिजिटल डेंटिस्ट्री basically with the scanner, intraoral scanner, can help bridge this gap. The second thing that can bridge this gap is photography. You don't need a DSLR. I said, if you want to just communicate with the lab, your mobile phone is enough. So I want to discuss these two things. First, let's talk about impressions and scanners. Impressions are not less accurate than scanners when it comes to the final prosthesis. They are equally accurate. There is no difference of accuracy of an intraoral scanner over an impression. The problem lies that the impression gives you a negative replica, whereas a scan gives you a positive replica on a big screen TV. So I always tell people, don't use a laptop. Connect the laptop to a 60-inch TV. अगर 3-4 लाख रुपए का स्कैनर लिया तो एटलीस्ट 50,000 रुपए का टीवी लो, ताकि आपको बहुत बड़े स्क्रीन में आप सब कुछ देख सको. नाउ अगर उस स्क्रीन में आपको मार्जिन नहीं दिख रहा तो मैजिकली टेक्नीशियन को लैब में मार्जिन नहीं दिखेगा. प्रॉब्लम क्या है? इंप्रेशन लोगों को पढ़ना नहीं आता, तो नेगेटिव रेप्लिका जो है लोगों को पढ़ना नहीं आता, तो उसमें अगर उसमें सब कुछ ठीक है कि नहीं, वी डोंट नो. सो व्हेन दैट गोज टू द लैब जस्ट मेक्स एन आर्बिट्ररी मार्जिन एंड डज द वर्क एंड सेंड्स इट बैक टू यू. बट डिजिटल डेंटिस्ट्री में क्या होता है, जो भी आप कर रहे हो आपको डायरेक्टली इमीडिएटली इंस्टेंट पॉजिटिव फीडबैक आपको मिलता है. तो कुछ भी करेक्शन करना है आप उधर ही कर सकते हैं.
राइट.
लेट मी गिव यू एन एग्जांपल. जब हम स्कैन कर रहे हैं, अब हम स्कैन कर रहे हैं, जब हम मार्जिन को स्कैन कर रहे हैं विनियर का या क्राउन का, सडनली यू फील मैंने जब स्कैन किया तो इस स्पॉट पे ब्लीडिंग आ गई या इस स्पॉट पे कुछ प्रॉब्लम है, तो क्या करना है आपने? सारा स्कैन को वैसे ही रखो, सिर्फ उस एरिया को डिलीट करो. राइट. सो दिस इज पैच वर्क. डिलीट करो, ब्लीडिंग को रोको, हीमोस्टैटिक एजेंट्स यूज करो या इलेक्ट्रोकॉटरी यूज करो, सॉफ्ट टिश्यू लेजर करो, कुछ भी करो, उस एरिया को साफ करो and just scan that area again. So the quality of work that you send your lab improves with the scanner, not because the scanner is more accurate, but because the scanner can give you instant positive feedback. This is particularly important for people who are not very good at reading impressions.
Okay.
So impressions, so intraoral scanner के बहुत सारे advantages होते हैं.
अगर आपका इंटरेस्ट जनरेट नहीं हुआ है impressions को रीड करने में,
मतलब yeah, and scanners have a huge lot of advantages which everybody knows. So I don't want to talk about that. Patient experience, ये वो gagging, shagging, वो सारी normal चीजें सबको मालूम है. मैं इसमें I really want to give importance to one aspect, that it makes you a more thoughtful dentist and it gives you instant positive feedback. So your quality of work may improve if you take that feedback positively.
Right.
That is number one. So that is how you close the gap between the lab and the technician. Pehle. Okay, that's how scanners help you, and it goes immediately. You can for complex cases, for multi-unit cases, you have you can especially for patients who are traveling abroad or who are out of station patients. You don't want that problem के lab वाले ने बोल दिया कुछ खराब है, patient को chair पे ही रखो. Send the scan immediately.
अभी बताता हूँ.
लैब वाले को पहले से बोल दो कि हाँ, my tooth preparation will finish by 2 o'clock. So be around your computer at 2 o'clock. वो फटाफट स्कैन देखेगा, बोलेगा ओके, फिर पेशेंट को टेम्पराइज करके घर भेज दो. उससे पहले टेम्पररी भी करने की जरूरत नहीं है. So there you are closing the gap between the dentist and the technician. The second thing I want to talk about is the photography. If you don't send a photograph for an anterior restoration case, even if it's a single tooth or 10 units,
True.
you are completely working in the dark. So what is my advice? Take your mobile phone. Don't have to buy a fancy camera. You want to buy, that's better. But if you don't think that is the barrier of entry of good quality work. Take your mobile phone, connect it to a ring light or two separate twin flashlights, continuous lights, LED lights that have a meter behind it, that where you can see clearly 5500 Kelvin, which is the same color temperature as daylight. Set it to 5500 Kelvin, take a couple of photos, take a couple of videos, take a photo with the shade tab in the same frame and send it to the lab. If the stump, that means the abutment, is discolored, or in fact in all cases, after finishing tooth preparation, take a photograph of the prepared tooth also. So the technician has the base color of the abutment, and the technician has the color which he wants to create. You've given him this two information, that is more than enough for single teeth and two teeth restoration. So 90% of your anterior aesthetic work का lab communication आपका यहीं पे खत्म होता है. That is very important. So this is how you reduce the friction between the lab and yourself.
Yes.
The other thing I can also add is that, listen, you don't always need to work with your local labs, especially when people in tier 2, tier 3 cities are very comfortable giving work to within their city. If you're going to start doing higher quality work, you don't always need to work with the lab which is closest to your house or closest to your clinic, because today logistics is not an issue. Everything is an overnight flight. तो 2 से 3 दिन में पूरे इंडिया में कहीं से भी आपका लैब वर्क आ सकता है. प्लस एक तरफ तो आपने डिजिटली भेजा हुआ है मे बी, तो एक तरफ तो वो इंस्टेंट है, बस एक तरफ से वो वापस आएगा. तो एक हफ्ते के अंदर अंदर यू कैन गेट एनी वर्क फ्रॉम एनी लैब. सो डोंट लिमिट योरसेल्फ फ्रॉम जस्ट 1 or 2 labs that are in your vicinity. So this is just some of the pointers that I can
ये जो
offer.
मतलब ट्रेनिंग हाथों की है, ब्रेन की है, उसके साथ ये माइंडसेट को भी थोड़ा स्विच करना जरूरी है कि ये डे टू डे में, क्योंकि बहुत टाइम से हमने देखा भी वही है कि यहाँ पे ये सब कुछ चल रहा है. सीनियर्स को पूछ लिया आप कौन सी लैब पे बेचते हो, वो भी यही बता देते हैं, तो ये कंटिन्यू होता है. आई स्टिल रिमेम्बर आपने एक एक्सरसाइज भी बताया था कि ये अगर लैब और डेंटिस्ट का कम्युनिकेशन में जो ये फ्रिक्शन हो रहा है उसको अगर इफ यू वांट टू रिड्यूस इट, जस्ट डू वन एक्सरसाइज. एक आप इंप्रेशन लीजिए, कास्ट पोर कीजिए और आपके सामने रखिए, और अभी आप सोचिए कि इस पे मेरे को अगर कुछ बनाना है तो मैं कैसे बनाऊंगा.
बिल्कुल.
तो आई थिंक यू नीड टू चैलेंज योरसेल्फ.
यस.
और आप
सोचो कि आप लैब में बैठे हो और आपको कुछ बनाना है. अगर एक फोटो नहीं दे रहे हो, एक ब्राउन कलर का मॉडल दे दिया और फोटो के बिना दे रहे हो, तो कैसे बना पाएगा यार वो. So that you're just making it so difficult for yourself.
So one more thing I feel is in patient-doctor communication, the most misunderstood thing is value versus affordability. Most of the dentists feel that price is the problem. But what I felt is price is not always a problem.
Yes.
You need to address fears, you need to address doubts, you need to address patients' insecurities, from where they are coming from where their thoughts, I would say excuses, the reasons. You need to respect all of them. तो कहीं ना कहीं पे ये अगर कुछ मामला जम नहीं रहा है, तो ये फ्रिक्शन जैसे लैब का हमने कम किया, वैसे ये फ्रिक्शन कैसे कम कर सकते हैं
यार. देखो, yes, value versus affordability. A lot of times we confuse affordability with lack of value. We think that the patient can't afford something, but it's not that. It is that the patient has not seen the value in the treatment that you're providing. So you've not sold the value. And फिर लगता है कि patient can't afford, patient is having an affordability issue. There are so many patients who we treat today who are coming from other dentists, who may have done the treatment in maybe half or 75% of the cost, and now we are charging them a significantly more amount of money, and they're happy to get that done from us. Why is that? That is because they can see that we are going to provide value for the money that we're charging.
Exactly.
Let me give you another example. Because I am in the education circuit, and because a lot of dentists in the country I'm in association with a lot of dentists around the country. So what happens? They start referring patients to me. Now they are referring patients in tier 2, tier 3 cities where the cost of that veneer or the restoration might be less than half of what we charge. But those same patients are coming to our practice from those cities where they might be getting something for, again, less than half of what we charge, and they're willing to pay that charge in Delhi. Suddenly, how did they get the money to pay three times the price? They got that money from where? They always had the money. So they never had an affordability issue.
Okay.
They had a value issue. They could not find value in the treatment that maybe that they were getting in some other practice versus when they come to our practice. So you must be able to create that value. How do you create that value? You don't sell the treatment.
Okay.
You sell the outcome. You sell how that patient will benefit if they get this treatment.
Exactly.
And what will happen if they don't get it. But focus more on what they will get for it. You'll be able to eat from both sides. Right now you're eating only from one side. That is what you sell.
Or it
you
can
don't
be
sell the
aesthetics,
implant.
or it can be function, or it can be speech or anything.
Yes. So if you have missing teeth on one side, you sell the ability to chew on both sides. You don't sell the implant. Nobody wants an implant. People want teeth. People don't even want teeth. People want the ability to chew and function and prevent further degradation. So sell that. The other thing is, in larger treatments, in complex rehab treatments, phase the treatment.
Okay.
You know, you can give phase 1, phase 2, and phase 3. So you can finish phase 1, and then once that gets over, patient gets confidence to now start doing the more complex work, perhaps even the more expensive work. Don't sell everything altogether. Try to break it down so it becomes easier for the patient to accept, especially for new patients who may or may not be comfortable in a new practice. So develop that confidence in a sequential manner.
Okay.
That is important.
I think while taking a new courses from the mentors, you also need to clear your why. That why am I taking this course, and how am I going to put this skill in front of my patients?
Yes.
Or how these skills will be adding value to my patients or my the treatments I offer.
Yes.
So I think
No, so that is why if you go to a mentor who is a clinician himself, what is he trying to do? He's just telling you stories from his own practice.
Yes.
He's just telling you exactly how he sells the procedure.
Right.
He's telling you exactly what he or she does every day in their practice. तो उसमें कुछ fluff नहीं है, उसमें कुछ BS नहीं है.
Yes.
It's just straightforward. I am doing something in my practice every day. I am doing it till Thursday evening. Friday, Saturday, Sunday, come and learn from me. I'll tell you exactly what I did on Thursday evening. That's it. That is the motive of a clinical course that happens by a clinician.
After this long conversation, now I feel that dentistry, I have felt this since many years, but still, I again felt this today, that dentistry is such a vast field.
Yes.
Dentistry is hard, dentistry is precise, and dentistry is tedious. I think people keeps on, especially in India, people keeps on comparing this field again and again with other fields. We don't want to mention all those fields here, but yeah.
But dentistry is extremely fulfilling. Why do I say it's fulfilling? Let's consider a medical professional who is doing, let's say, maybe orthopedics or something like that. They need to be associated with a hospital. They need fancy MRI scans, CT scans, beds, hospitals, and they have to always be associated with all these huge institutions. A dentist, if he or she is lucky, is having almost everything they need under one roof, owned by them. Maybe barring a CBCT, which may or may not they might have, but if they have that also, then every single thing that the patient needs is provided by you in your own practice. So you have so much freedom in your decision-making process, in your ethical treatment planning. You don't have anybody on top of your head telling you what to do. You don't have, commissions or commitments to various overlords. You are your own boss. And I really, really, really value one thing that dentistry has given me, which is that I am answerable to no one. I am my own boss. I have my own timings. It gives me immense pleasure to be able to work so hard. You know, I'm a small business owner. I'm an educator. I have, of course, clinical dentistry. I'm a content creator. I have 5 things that I have to do. even then I am able to give a lot of time to my family. So I find it very, very, very satisfying that I can work hard and still provide a lot of time for my personal stuff, which is including maybe fitness, family, everything. And that's not possible if you know, or it's much more difficult
Exactly.
for
Those are the points
for other industries.
on which we can argue on.
Yes, I don't envy my corporate friends, even if they have amazing salaries. I don't envy them because the amount of freedom that they have is significantly lesser than what we have. So
तो कहीं ना कहीं मतलब वो स्टूडेंट्स के दिमाग में वो सेल्फ एस्टीम पे आता है ना, इफ वी आर नॉट कंपेयरिंग, इवन नॉट कंपेयरिंग आवर फील्ड विथ अदर ब्रांचेस और अदर प्रोफेशंस, कहीं ना कहीं पे वो सेल्फ एस्टीम भी डाउन मत करो. डेंटिस्ट्री इटसेल्फ इंडिविजुअली इज really fulfilling.
For me, BDS was my first choice, unlike many of your viewers and listeners.
It should not be a trickle down.
My BDS was my first choice, of course, because I'm second generation. But believe me, even today, after so many years of being in practice, I would never want to switch my line for somebody who had done MBBS and MD.
Yes.
So there's one thing that I really want to share with you. Very often, I get DMs or WhatsApp messages from junior dentists, and they will send you a message that loosely reads like the following: "Sir, your work is very inspiring. I would love to learn from you. Do you have a job opening, or do you have a job vacancy?" अब इसका क्या मतलब हुआ?
आप कुछ सिखाओ और उसके
मतलब मैं आपको सिखाऊं
हाँ
और मैं आपको पैसा दूं तो आपने मेरे लिए वैल्यू क्या क्रिएट किया? सो दिस इज माय एडवाइस टू ऑल द पीपल हु आर अप्लाइंग फॉर अ जॉब in dentistry. Whenever you apply for a job, always start with what value you can create for the dentist that you're applying to, for the clinic that you're applying to. आप क्या कर सकते हो उनके लिए? Yes, then definitely you will learn on the side, but that cannot be your opening line. Your opening line cannot be, "I'm coming to learn from you." The opening line has to be, "I can create value for you. Please hire me." And I am looking forward to learning something also. So that is a benefit of job that you will get. What is the benefit of job that the employer will get? You have to start with that, right? You are applying for the job, right?
क्योंकि वो तो टेम्पररी हो गया ना, वो सीख के एक बार चला जाएगा.
Correct. If I am seeking you for my job, then I have to tell you what value you can get when you work for me. But if you are seeking for the job to me and I am the employer in this situation, then you have to tell me what value you can add. So always start with that. Boss, don't come here telling me that you want to learn.
Yes.
He has a very big clinic.
Exactly.
So I said, don't come here because you want to learn. Come here because you can add value, and then maybe you will learn something.
Okay, so now, sir, once a professional enters to this dentistry, there is one thing which he realizes really late in his career path, which is fitness. क्योंकि हमारा फील्ड ऐसा है, कहीं ना कहीं पे मालूम नहीं पड़ता. और इनिशियली जैसे आपने बोला कि इफ़ यू आर नॉट यूजिंग मैग्निफिकेशन और लूप्स और यू आर नॉट वर्किंग ऑन अर्गोनॉमिक्स, तो एज ऐसी चीज़ है जो इरिवर्सिबल है. तो कभी ना कभी आपकी बॉडी आपको जवाब देने ही वाली है, बायोलॉजी अपना काम करने ही वाली है. सो यस, आपके साथ वो बायोलॉजी की बात हुई थी, एंड ऑफ कोर्स यू आर अ फिटनेस एंथू.
I let me admit to you that since about the last 3-4 years, I am having lower back issues.
Okay.
Even though I like to think that I'm very active, even though I do a lot of running, I do a pretty decent amount of strength training. I'm always doing something or the other with my son, or I'm always outdoors. So I do a lot of fitness stuff. I've also been focusing specifically on my lower back strength and physio. Still, I am facing some amount of discomfort, which is improving, but it's still there. Till I was 35, I'm almost 40, I'm going to turn 40 this year. Till I was 35, I thought कि ये सारी चीज़ें तो किसी और की प्रॉब्लम्स है. लोअर बैक ये तो सिर्फ जो बिल्कुल अनफिट होते हैं उनको होता है, ये वो सारी चीज़ें.
Okay.
And it's happening to me. I think taller people get it more. I don't know what the situation is, but it's happening to me. And I'm not even 40 right now. And I want to work at least this intensively for another 10-15 years. Maybe then I'll start slowing down, right? So it is a little scary. I wish I started earlier, but dentistry should be considered as a real physical occupation. It's not a desk job. and it takes a big toll. Some people will have it in lower back, some people will have it in their arms or their necks or somewhere around the spine. So you really have to take care of yourself. There's two ways to take care of yourself.
Okay.
One is to strengthen the muscles
Right.
so that they can protect your joints and spine. And the other is to reduce the insult on your body by proper ergonomics. So proper ergonomics comes from the magnification, and of course exercise is what is going to strengthen the muscles around the areas to prevent degradation.
Even we can do yoga.
Yes, and yoga, strength training, running, just being active, and of course, doing a lot of stretches, all of that. And when we were talking about loops and magnification, I never even mentioned that it's good for your back, because there's so many other advantages of using magnification. कि good for your back is not one of them. अगर मैंने वो पहले बोल दिया होता, so then the juniors would think यार ये तो कुछ बुड्ढों वाली बातें बोल रहा है about ergonomics. So I don't want people to think that loops is for ergonomics. Yes, that's the side benefit. The main benefit is quality of work.
And with that, I think we have covered not just the dentistry part, but I think the way of, not just the way of building our practice, but the way of building oneself.
Yes.
So yeah, it was nice talking to you.
Yes.
I think मैंने questions ठीक ठाक पूछे, हमारा
बिल्कुल.
discussion ठीक ठाक हुआ.
It's fantastic.
Yeah.
I want every young dentist to know that our profession is not saturated. Our profession is not in some kind of decline. There is a lot of quality of life. There's a lot of amazing stuff that you can do in dentistry. Dentistry can really improve your quality of life. If you love dentistry, it will love you back. You just have to find things that you're really good at so that you can stand out in the crowd. If you keep doing the same thing that everybody else is doing, then in any profession, you will think there is saturation. You have to do something different, and you have to do something different and maybe something better than what the other people are doing. And that doesn't mean that you have to be good at every aspect of dentistry. Find things that you love about dentistry, even if it is non-clinical. There are so many non-clinical things that you can do in dentistry. You can get inspired by you. You're doing so many things here.
Yeah.
So there's so much to do in dentistry.
Okay. So I think I have done enough justice by asking you a valid questions.
Yes, absolutely.
I tried to get all the answers जो कि आपके और मेरे viewers दोनों को चाहिए होंगे.
बिल्कुल.
And I hope you enjoyed being.
I love being here, and I will see you guys in the comments.
Yeah.
If you have any questions to ask me, just type it in below, and we'll probably try to reply as much as we can.
I think मैं यहाँ से जाके अपना एक और नया interest I'll try to discover my new interest and next episode में हम इसके बारे में बात करेंगे कि मैं क्या explore करके आया हूँ.
Excellent. Thank you.
Thank you.